do, and how has the experience been with the online?
My name is John Timothy. I'm from Canada. I did my bachelor's in nursing, and I'm currently pursuing a master's in nursing as well. Currently work in the emergency department as a registered nurse. And the experience for learning this course was amazing.
What made you decide to jump into aesthetics? I'm always curious.
Well, I always wanting to find a very niche specialty that I can actually make a very tangible result in patients. As a registered nurse, you can generally make positive impact in patients, but there's nothing that you can claim yourself that actually I produce that result. So that just put me into a position where looking for a specialty that I can do that. And it's accidentally aesthetic comes my way. I recently had a hair transplant, and I went to the clinic, and I completely blew away the kind of a mesmerizing world of medicine that actually as a nurse I can practice, and how that made me feel as a client in that clinic. That was great, and I just go, you know what, I'm gonna go and explore. So here I am.
Thank you for sharing. Okay. How long you were or have you been working you said in the ER, you said?
Yes.
How many years?
So I've been a nurse since 2010, and emergency department
You've
for
gone
3
over
years.
10 years of
Being a nurse, yeah.
It's a burnout in any specialty, regardless if it's ER or not, and the COVID made it worse. I mean, lots of people changing
Sure, yeah.
the medical field, changing careers because of that. They got burned out. Okay, and they thought again, it's like, hey, I might want to do the rest of my life the same thing. Okay, that's why I'm curious to see what your intention. I'll share my experience why I went from internal medicine to aesthetics years back. Go ahead, please.
My name's Jennifer Gross, and I'm a registered nurse. I'm from Orange County, and I worked in mostly outpatient surgery for 4 or 5 years, and then I started having kids, and my kids are now in college, so I have some friends that work in the cosmetic world, and they invited me to join them. So I'm here today to learn more, and I've been just going in and observing them, doing a lot of Botox, a lot of fillers, hydrofacials, like just a lot. It's just a really fun environment to be in. So that's what brought me here today.
I totally agree. It's a fun field. It's really rewarding for you and your clients when you turn, again, because you're not only changing or treating medically, but you're changing their confidence in themselves, changing the way how they look, where they feel negative about certain looks, and they get educated. That's part of your important piece, part of the job that you have to do is to manage micromanagement. Like some clients, I call them client, not patient, they micromanage their face. And you have to really have them change in that because they'll be always feeling negative about themselves. And that's really one of the important part of gives you rewarding is to kind of change the way how they think about their body, their face, and so on. And it's actually priceless. Yeah. Go ahead, please.